Good evening, good evening, good evening. I'd like to say hello and welcome each and every one of you, and thank you for joining us for our healing conversation tonight, entitled What We Lost During the Pandemic. What we lost during COVID. So, if you can please let us know where you are tuning in from and drop it in the chat so we can shout you out. Again, welcome to the healing conversation on tonight, what we lost during COVID. So I'll be checking the chat to see where you are tuning in from. So please let us know. All right. We are excited to have some of you in the building and delighted that you are tuning in tonight to join us for a really important conversation. Thank you. Hey there, Desiree Elder, checking in from Harlem. Good to see you. Thank you for joining us today. Hey, Liana Cumberbatch, please save this live. Okay, we will do our best to honor that request. Thank you so much for tuning in with us tonight. Let us know where you're tuning in from. Hey, Lori Kingsbury, grace and peace. Hey there. Shout out to North Manhattan Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Thanks, Lori. All right, we'll give it a few more minutes to welcome folks into the room and let us know where you are tuning in from on tonight. So far we know that we have Harlem in the building. We have the Upper West Side in the building. Hello, Rachel. Good to see you. Good evening. BX is in the building. Thanks for joining us tonight. All right. We'll give it a few more minutes because we like to welcome our guests and do a few shout outs. All right. Don't feel shy. We like to say hello. All right. Okay, again, thank you again for joining us tonight. Welcome to the healing conversation titled What We Lost During COVID. Before we get started on anything else, I want to welcome a special guest into the room. She is joining us, and she is the president of North Manhattan Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Please join me in welcoming Rory Mills.
Good evening, and thank you so much, Dr. Green, for the welcome. North Manhattan Alumni Chapter is excited to partner with the Hope Center on this conversation, and I want to give a special thanks to Dr. Shear and Dr. Hankerson for their participation as well. And we believe that everyone will receive something from this conversation because we all can relate as the pandemic has had a great impact in our communities. So again, thank you so much for joining us on behalf of North Manhattan Alumni Chapter, and we're excited to hear what this conversation will bring. Thank you so much again, Dr. Green, who is our chair for our Health and Wellness Committee of North Manhattan Alumni Chapter. And again, we look forward to future opportunities. Thank you, Dr. Green.
Thank you so much, Rory, for the warm welcome. We'd now like to kick it over to Julius to share a few announcements with all of you.
Hey family, welcome to Healing Conversations brought to you by the Hope Center, where healing takes center stage. I am Julius J.U. Jones, and yes, these are your Hope Center Harlem announcements. The Hope Center continues to guide us on our journey of healing on purpose and evolving by minimizing the stigma around communities of color seeking mental health services. Be sure to check out upcoming March programming, including Think It, Say It, Do It, a new Hope Center series in partnership with author J.R. McDonald is here to remind us to laugh, dance, and use transformational words to catapult us to new dimensions. Are you ready to join the Think It, Say It, Do It movement? Tap into the Hope Center's Instagram on Friday, March 11th at 12 p.m. noon to change your words and change your life. Mindfulness Ascension from the Pandemic, which is a 6-week series that meets on Thursdays at 7 p.m. and focuses on different types of mindfulness practices, including guided meditation, breath work, gratitude journaling, and more. Writing for Wellness is also a 6-week series that will explore how writing can be used as a tool to increase well-being, reduce stress, and explore feelings in a welcoming environment. Tap in on Zoom on Fridays at 4:30 p.m. The Hope Center presents The Pride Room, a 6-week virtual group therapy experience to discuss the journey of being a part of the LGBTQ+ community. The group will meet on Wednesdays at 12 p.m. on Zoom. The Pride Room is a safe space where participants feel comfortable to be their true and authentic self without the concern of being judged. The Hope team will assist you in continuing your unique journey as an LGBTQ+ identifying individual and provide you with the support needed to thrive. We hope to see you there. Participants must register at www.hopecenterharlem.org/events. The Hope Center is proud to partner with the North Manhattan Alumni Chapter of Delta Sigma Theta Sorority Incorporated for upcoming events. Founded in 1913, Delta Sigma Theta Incorporated is a private nonprofit organization whose purpose is to provide assistance and support through established programs in local communities throughout the world. Mark your calendar and spread the word for this upcoming event. It's the first installment of the Financially Fit series with Audrey Washington of Fiercely Financial and the Economic Development Committee, which commences next Saturday, March 19th at 11 a.m. Eastern Standard Time on Zoom. Whether you are saving for a car, buying a home, or paying off student debt loans, this webinar, Financially Fit 101, Personal Finance and Debt Reduction, will provide information about managing your personal finances in order to increase your wealth. See you there. Well, that's it for now, Hope Center family. Remember to follow and stay in the know with all things Hope Center Harlem on social media. Whether you tap in via Facebook, Instagram, Twitter, or YouTube, the key is continuing to heal on purpose and evolve. The Hope Center's crisis text line is still free, 24/7 and confidential. If you ever need someone to talk to about life's multitude of moments, text WORTHY to 741-741. That's WORTHY to 741-741. Also, support Hope Center Harlem programming and mission through 2 easy ways to give. Whether you text to give or give via the Hope Center's website, all donations support the work of the Hope Center and are tax deductible. I am Julius J.U. Jones, and these were your Hope Center Harlem announcements. Now, back to you, Dr. Green.
Thank you so much, Julius. I hope that each and every one of you will tune in to some of the programming that is coming up over the next few weeks and get educated. All right. So we are going to get ready to start the other portion of our program and welcome our guests for tonight. Our first guest, Dr. Kathy Shear, is the Marion E. Kentworth Professor of Psychiatry and the founding director of the Center for Prolonged Grief at Columbia University School of Social Work. Dr. Shear is a clinical researcher who first worked in anxiety and depression. For the last 2 decades, she has focused on understanding and treating people who experience persistent, intense grief, which is now an official diagnosis called prolonged grief disorder in the Diagnostic Manual of Mental Disorders. She developed and tested prolonged grief disorder therapy, which is a short-term, strength-based intervention that helps foster adaptation to loss and confirmed its efficacy in 3 large NIMH-funded studies. The Center for Complicated Grief at Columbia School of Social Work is dedicated to improving the lives of bereaved people by increasing knowledge and understanding of grief through research, training, and community outreach. Please join me in welcoming Dr. Kathy Shear. All right. Our next guest is Dr. Sydney Hankerson, who recently joined the Mount Sinai Institute for Health Equity and Research as Director of Mental Health Equity Research at Mount Sinai. Dr. Hankerson was also appointed Vice Chair of Community Engagement in the Department of Psychiatry at Mount Sinai just recently in March of 2022. Currently on the faculty at Columbia University as well, Dr. Hankerson conducts research focused on the reduction of racial and ethnic disparities in mental health treatment, with a specific focus on depression. Dr. Hankerson has received several prestigious awards, including the American Psychiatric Association's Nancy C. A. Ross Certificate of Recognition for Excellence in Medical Student Education. He was also chosen as the 2021 Emerging Leader in Health and Medicine by the National Academy of Medicine. Prior to his move earlier this month, Dr. Hankerson served as co-director of the Columbia Wellness Center, associate professor of psychiatry at Columbia University Urban Medical Center, and adult psychiatrist at the New York Presbyterian Charles B. Rangel Community Health Center. Please join me in welcoming Dr. Sidney Hankerson.
Thank you.
All right. Now, before I bring both of our guests on the screen, I want to be able to share a few statistics with all of you. So, NYC adults reported increased symptoms of both grief and loss, as well as depression and anxiety related to COVID-19. And many of us have seen all of those things in our own personal lives, I'm sure. 35% of adults with children in their household also report the emotional or behavioral health of their children has been negatively affected by the pandemic. COVID-19's impact on mental health and risk factors include post-traumatic stress symptoms, stigma about mental health challenges, depression, anxiety, isolation, financial burden, and increased drug and alcohol use. So you see, we're going to be getting in and diving into some really important questions tonight. And that's just a little bit of what we've experienced right here in New York City, just to give you a little bit of a taste of the things that we've experienced during the pandemic. So now I want to welcome both of my guests and give them an opportunity to join us on the screen. So thank you so much. I first want to give you both an opportunity to say hello to our audience members.
So thank you so much, Dr. Green. It's such a pleasure to be here. And as you said, to be able to be in conversation with you and Dr. some of these very important issues that we're facing as a community. So thank you and welcome to everyone.
And I would just say thank you so much, Dr. Green, and the Hope Center for putting on this crucial healing conversation. So many of us in the Black community have been impacted by grief and loss in the midst of the pandemic, that I'm really excited and honored to be a part of this conversation this evening.
Yeah. Thank you both. You are both experts in the field, and we couldn't have more knowledgeable, more esteemed, and more caring and dedicated guests to join us tonight in partnership with North Manhattan Alumni Chapter of Delta Sigma Theta Sorority Incorporated for this really critical conversation. So let's jump in. We know that during the pandemic, many people, including myself, have lost loved ones. We lost our sense of routine and everyday habits. And we also experienced so many cancellations and restrictions, all in an effort to keep ourselves safe. But we all had to adjust to very new and unexpected ways in life. And so the first question that I want to ask you both is that, can you share more about some of what people may have lost during the pandemic? And either one of you can start.
Sure, I'll start. We have lost so much during the pandemic. I think one of the biggest things that we've lost from the social distancing requirements to reduce the spread of COVID-19 is we've lost a sense of community. Our churches had to be closed and then reopened, and many of them are closed again. And that was a huge source of connectedness and support. Our families were unable to gather oftentimes during the holidays. We missed time from friends and coworkers. And so it was a very, very isolating time. We've all obviously also lost people who we love and treasure. I lost a dear friend who was who was living in a nursing home. COVID went rampant through the nursing home, and she tragically died. So those are just a few of the things we've lost.
Thank you, Dr. Henderson. Dr. Shear?
Yeah, I think those are so important, and I guess we've also, so many of us have lost our ability to, beyond the community that Dr. Hankerson is talking about, just our ability to go about our lives in the same way that our everyday lives have been so affected by the, again, trying to keep safe. And that's meant just a lot of even small everyday things everyday interactions with people that we may have had that we no longer have. And of course, there are some of us who have lost so much more, who've lost loved ones, known people who have died, even if they weren't very close to us. It's very impactful. And also some people have lost jobs. Some people have lost their ability to feel effective in their jobs. There are healthcare workers who have lost that sense of understanding and effectiveness. So I think it goes on and on, really, but it's been a hard time.
Yes, thank you for that. And so one of the things that I was thinking about was, sort of the rituals that many of us sort of lost during the pandemic as well, right? So whether it's going to work or whether it's part of our routine. And so I'm wondering if you can talk a little bit more about why rituals are so essential, especially during the grief and loss process.
Dr. Shear, do you want to take that one?
Sure. So, I think one of the things about grief is that it's just such a profound and intense experience, and it's a time when we need our community around us so much more than usual, even, and it's also a time when it's hard to support people. It's hard to know how to support people, and rituals really help us know how to provide that support. They sort of hold the holding community, so to speak, and without it, people are especially when they're used to rituals, people can feel sort of lost and not sure how to be of most help to their friends and family who may be really struggling. So I think that's one of the reasons that rituals are so important.
And I love what you said about that. They hold the holding community. Yeah. Dr. Hankerson, do you want to add anything to that?
Yeah, I just think that rituals give us a sense of our own identity. We all have unique rituals that no one else maybe understands. And I think the grieving process can disrupt that. And it can make it very difficult for us to even recognize our own selves. And so I think trying to get back to the rituals and some of the normalcy that we used to do before a grieving process can be very, very therapeutic.
Okay. Thank you both.
That's so true.
Yeah. So many people that I've talked to have really felt a sense of guilt or feel like they didn't do enough for their loved one somehow during the process, whether it was COVID or during the grieving process. And so I'm wondering, how is self-care essential to the healing process?
You want to
Sure,
start that one off?
Yeah,
Dr.
so we
Hankerson.
can go back and forth. First of all, let me just say for our audience that Dr. Shear is really one of the world's most preeminent researchers and clinicians as it comes to grief and loss. She also happens to be one of the most humble, compassionate, and thoughtful and funny individuals that we have had the pleasure to work with. And so we're really lucky to have her here this evening. So I think one of the key things about loss that people who survive after their loved one passes is this notion of survivor guilt. As Dr. Green mentioned, there may be guilt about not having done enough to try to help the person, a wish to have spent more time with that person, maybe a desire to have a conversation that was never had. And there can be this sense of, why me? Why did I make it and my loved one did not? And that can be crippling. This feeling of guilt can be quite crippling. And so self-care is crucial to help people work through their feelings of grief, to help them acknowledge some of the mixed feelings they may have when they lose a loved one. Certainly loving feelings, they're sad for their loss, but they may be things that they're relieved that they don't have to deal with anymore. And so grief elicits a lot of different emotions. And so self-care helps people work through that mix of emotions, as well as help them return to a level of functioning that perhaps they didn't have as a result of the struggling with that loss.
Dr. Sher?
Excellent points, all of those excellent points. But I want to take a little bit of a different angle on this, because I think I want to say two things. I want to first of all say something about self-care, because what we mean by self-care is making sure that we have time in our life to experience positive emotions. Positive emotions means relaxation, yes, and respite, but it also means really positive emotions as much as possible during grief. And we can actually and do naturally have moments when we can actually have some laughter sometimes in our lives, some humor in our lives, or some affection and some pride in the person who died, and we can also have moments of real connection with the people who are still here. And those kinds of moments, especially the more that we can connect with the positive emotions in our lives, the better we can grieve, actually. So our grief naturally will oscillate between the pain and then the respite from the pain. And we really need to allow ourselves that. So the survivor guilt that Dr. Hankerson was just mentioning can really get in the way of that. And yet it's so natural. I mean, I think we naturally feel like uneasy or uncomfortable or even really guilty about just being alive when someone we love isn't. And it might be exacerbated with COVID. If we had COVID and we didn't die and they did, and it just makes us feel so bad about ourselves, and feel bad that we should have positive things in our life, but yet that's so important. And we actually know that our loved ones would want that for us also. So just to remember that. And the other thing I want to say is that part of what we've learned in working with people who are grieving is that people naturally have what we call caregiver self-blame, actually, after someone we love dies, because we all really want to take good care of, we want to be there for people, we want to take good care of them, we want to prevent bad things from happening to them. And even if we know in our sort of highest level brain thinking, we know that we aren't responsible for so many things, we still feel like we are. And there are always things, as you said, Dr. Hankerson, that are left unsaid. There are always things we could have done differently, and our minds naturally go there. So we have to kind of be aware of that, and also kind of gently set that aside, allow ourselves to set that aside, because that guilt can really make it so much more difficult than it's already going to be difficult to not have this person in our lives. And the guilt kind of layers onto that. So self-care and positive, having some positive things in our life is just really, really important, even if it's small little things that we build into our lives. We actually encourage people to build in small, everyday little, even like rituals, talking about rituals that might be that, just doing whatever they can to bring something positive into their lives.
Absolutely.
So thank you for that question. Yeah.
Yeah. And I want to encourage all of our audience members to think about the ways in which they can also engage in self-care. Uh, I know that I do things that allow me time for joy and laughter and cultivating time with friends. And so while we're on that question, before we move on to the next one, right? As mental health clinicians, we're always a holding space for all these other people, right? For folks that we see, and then for also folks that we supervise. And so I'm wondering the ways in which you engage in self-care, just one or two things that you can share with our audience members about how you take care of yourselves.
Dr. Shear, you can take this one first. We can just go back and forth.
Okay. Okay, that's good. So, well, I mean, I engage in self-care in whenever I can, for one thing. So, and that means, as you said, I mean, friends and family are so important, and making sure that I do take that time to spend with my friends and my family. And the other thing I like to do is go on walks and listen to audiobooks. I mean, I'm a big audiobook fan, and I love listening to all kinds of books, basically. So those are a couple of things I do.
Okay, thanks.
I know for me, self-care involves therapy. I've actually been seeing a therapist since I was in medical school, and it is something that grounds me. It has gotten me through some very, very challenging times, including loss of family members. And so therapy is absolutely a part of my self-care plan. I also like to exercise, to practice self-care. That became very difficult during COVID, of course. But now that gyms are back open, and we've had to learn how to be creative in our small spaces in New York City in terms of exercise. That's another way I practice self-care.
Thank you. And so while that question is up on the screen, I want to encourage you all to drop that in the chat as well, and let us know what are some ways that you engage in self-care. All right. Moving on to our next question. It's about dealing with grief. And so in dealing with grief, as many of us have, at what point does it become a problem or a challenge that we should seek help to address, right? So that's one part of the question. And then also the other part of the question is about, what about mental health challenges overall? So how do we know when it's time to seek help and to address it?
Well, I'll take the mental health challenges part. I'll certainly defer the grief part to Dr. Shear and her wealth of expertise on that. So I think it's important to realize that mental health conditions really make it extremely difficult for you to carry out your normal activities. It makes it difficult for you to engage in relationships. It makes it difficult for you to work. It makes it difficult for you to attend your sorority meeting or do things that you love and enjoy. In fact, we know that in New York City, clinical depression is the #1 cause of disability. So more people are suffering, are not able to live their best lives because of depression than any other medical condition. And so it's important, for folks to realize that mental health conditions can cause a tremendous amount of emotional, spiritual, and physical pain. And so I think it's, one of the kind of standards by which you can realize or kind of gauge is if you need help, is if you're having difficulty completing the things that you would normally do. If you can't do your rituals or your routines, or if you find it really, really difficult to focus at work, if you're having trouble sleeping, or if you're having thoughts that it would be better for you to go to sleep and not wake up. So I just want to take this time to talk briefly about suicidal thoughts and behavior, because they have been so prevalent in the Black community. We have had a huge rise in suicidal thoughts and behaviors over the last several years in the Black community. And it's important to realize if you are having those thoughts, please call the National Suicide Helpline. Get help. It's not something that you should try to push through on your own.
Yes. And I'm just going to ask that we make sure that we share that number in the chat for our audience members so they can jot that down or take a picture of it while we're continuing the conversation. Dr. Shear.
Yeah, I think that's such an important thing to do and such an important point, Dr. Hankerson. So thank you for making it, because actually I'm going to talk about grief in this, what do you do? How do you know when grief is kind of something that you're not handling or that you really need some help with? And I would say, first of all, the first thing to know about that is that grief is so natural. I mean, grief it really is the natural response to a meaningful loss, to any of these kinds of losses, but it's especially, it tends to be especially intense and difficult when it's the loss of a loved one, and especially someone who's been really in your life and so important in your life. And that's happened to many, many people, sadly, over the last couple of years. It happens always, but we've had a really marked increase in the rates of death of people, as you well know. So one thing is to give yourself a break. So understand that you are going to feel something pretty intense, and that's, again, natural. And what you need is self-compassion. You need to be really careful not to start criticizing yourself for not being there, because it's true that when you can't do the things that you usually do over a long period of time, you do want to make sure you get some help for it, and especially if it's depression. But when it's grief, when what's on your mind is the yearning and longing for the person who died, and the lots and lots of thoughts and feelings about them, and a sort of feeling of that loss is what's filling up your mind. That's so natural, and we all need that time out. So we need to give ourselves a break. And even if we're in communities or jobs or whatever that are requiring us to go back before we're really ready, and we may not be able to do our best job, not to be self-critical about that is so important. And I think the other important thing is to have someone that you can talk to, someone that is, often we have our friends and family around us at this time, and they are people who can listen to us and really feel supportive for us. But sometimes that's not true. Sometimes, for a variety of reasons, those people, maybe they're grieving too, maybe they just can't provide the support we need. And so that's one time that you absolutely should reach out, because there are people in the community that can help. There are people at the Hope Center that can help you if you're feeling like you don't have someone to share this pain with. And then the other thing is, if things just go on too long, and if you get kind of caught up, if you can't set aside that caregiver self-blame or that survivor guilt that we were talking about earlier, if you really can't get that out of your mind, that's another indication that it's a really good idea to seek help for that. So we now have a formal diagnosis, which we can talk about later, but I think those are the main reasons the main things I would point out right now.
Thank you. And so you hinted at the next question, which is, what are some ways that people can effectively manage their grief, right? So one of the things that I hear from folks all the time is that even if they are interested in getting therapy, that sometimes they can't afford it, or the wait to get a therapist or get connected to care in some way, shape, or form is really long, right? And so we know that, not everyone can get connected to mental health care so easily. And so what are some of the ways that people can effectively manage their grief?
So I think I'm supposed to do this one first. And so one thing is that there are grief support organizations that have grief groups, and that's happening online. It's been happening online, but it's continuing online, and also I think back in person now. So that's one direction to go in, and I think it's a really good idea. There are also a lot of websites that you can go to that have interaction and also have a lot of really good advice about grief. Maybe we can make those available at some point. Also, so that's another place to go. And then in terms of taking care of yourself, I think, again, following those pushing yourself to do the self-care, making sure that you're doing self-care, making sure that you're not criticizing yourself, that you're feeling compassionate with yourself. If you're struggling, if you imagine that you were your good friend, and how you would treat that good friend who is struggling, and be sure you're treating yourself that way, because a lot of us don't do that, right? A lot of us would never think of being not compassionate to people around us and people we love, and yet we treat ourselves, we expect too much of ourselves. We're too quick to criticize ourselves. So we need to be kind to ourselves. And we need to understand too that we're not different from everyone else because we're suffering. We are connected in a way by our suffering to all of humanity. And we need to also understand that this is not going to be forever. And actually, we do naturally adapt to loss. Most of us will, even though when we can feel like it's really never going to happen. If we don't get in our own way by getting too caught up in self-criticism and guilt and anger that can come around, and if we can let go of those, or we can find a way to set those aside, we're going to be able to move forward in our lives. But I do think that finding a place to get help from grief therapists and grief counselors is a really good idea, in addition to mental health professionals.
All right.
The only thing, that was such a comprehensive answer from Dr. Shear. I would just say, especially of us in the Black community, is if you are struggling with grief, the first step to manage it is admit that you are struggling. So many of us just press on and have a difficult time acknowledging our emotional pain. We just keep pushing and pushing and pushing. I think the first step to managing your grief is admitting you need help, and then following all of the steps that Dr. Shear mentioned.
Yeah. Thank you for making that point known. So admitting that you need help, seeking out resources, and giving yourself some grace, and thinking about how would you treat someone else if they were in your shoes. Thank you for that. So we know that it's normal to feel overwhelmed by the intensity of feelings that may sometimes last for longer than someone may expect, right? When connected to grief. So how do people set realistic expectations about the amount of time it takes to heal from grief and loss?
Wow, that's a really wonderful question, and I think that I came from the tradition in psychiatry as a resident, where we had to look at bereavement in terms of 6 months. That's what I remember in terms of diagnosing depression. So I thought, okay, some people should be able to cope with the loss of a loved one in 6 months. And I learned that that's not necessarily realistic, depending on the nature of the relationship, depending on how close that person was to them, depending on so many other factors. So I certainly will say that time is on a case-by-case basis in terms of how long it can take. And I do think that considering the nature of the relationship with that person, as Dr. Shear mentioned, if it's a significant other or a really close loved one, that impacts the relationship. I think the key thing to consider is, how is the loss impacting your ability to carry out your daily activities? How is it impacting your ability to function, to love, to learn, and to live? And as that becomes more and more difficult, I think that's an indication that you may need to get help.
Yeah. And Dr. Shear, before you jump in, I just want to also acknowledge that, right? Culturally, we all have very different expectations about what our cultures say we should, how we should grieve, and the ways in which we grieve and how long we grieve, right? And sometimes there are very specific things culturally that are connected to grieving. So I did want to acknowledge that because, culture plays a big role in what we do and how we do it.
Absolutely. I think that's, thank you for making that point, both of those points. And, actually, what I think is that grief, grief really is, so what we say, one of the things I often say to people is that what I've seen is that grief emerges naturally after we lose someone close, especially and intensely, and it kind of takes up all the space in our mind, and then over time it finds a place in our life. It doesn't go away. And even when it's found a place in our life, it can sometimes get really intense again. It can get kind of activated, and it does. And so it really kind of takes a lifetime in one sense. And exactly how it goes, as Dr. Hankerson said, it's so individual. And as Dr. Green said, also it's often dependent on our culture, how intense it is for how long. But what our new diagnosis says is that after a year, if it's still taking up most of the space in our mind, it's not that it's gone. We shouldn't expect it to be gone by any means. But if it's taking up most of the space in our minds and our thoughts, and it's really hard to feel connected, really connected to our own lives or other people that we care about, or the rituals or any of it that are, to our community. When that's really your point, Dr. Hankerson, that and we feel all of those feelings very naturally over the course of dealing with a loss. But if it's just going on and it doesn't seem like it's getting even a little bit easier, and it's at least a year afterwards, that's when we're going to start to think maybe this is really a prolonged grief disorder, which really isn't that different from ordinary grief, from any other kind of grief either. But it does maybe mean that something's getting in the way, something's kind of stalling that process of coming to terms with the loss. And we do know how to help that. So that is really an indication to reach out.
So I just want to reiterate that for our audience members, that if you are still experiencing grief and it's taking up still so much of your thought process and in your mind, that then we want to really think about the fact that this is really, getting in the way of our ability to function at our best. Is that right?
That's right. And I guess the other thing, I think what Dr. Hankerson said was so important to also, because sometimes the way that works is it's taking up a huge amount of space, but that space is compartmentalized. It's set aside. And the way that feels is that we're going through the motions in our life, but it's not meaning anything anymore. It's sort of like we're not really there. We're just doing it, and we're not thinking about the loss because we can't bear to, in a sense. And so that's another way that it can kind of, and maybe we're trying to even, medicate it away with alcohol or drugs, or do something that isn't really that healthy for us, just to keep all of that at bay. So that would be another way to look at a need for someone to kind of help us out of there.
Yes. And thank you for dropping that in the chat, Wanda. Wanda said that, related to what you just said, walking around numb, right?
Yeah. Yes.
So that's an indication.
That's so important. Yeah.
Thank you, Wanda.
Yeah. Thank you.
So I don't want us to forget about our littlest humans, right? When we're thinking about children. And so do children experience grief differently? And how, and if so, right? I mean, children are experiencing grief, but do they experience it differently? And then also, how can we talk to children about grief and loss?
Dr. Sher, I'll let you take that one first.
Yeah, I was afraid you were going to say that, because I think you're kind of talking to the wrong people here. I'll tell you what little I know about this topic, because I am definitely not an expert in child grief, but I do know that children grieve very differently than adults. And, they do most things very differently than adults, really. When I was raising my children, I used to think that they were, they were they looked like little humans, but they really weren't because they act so different in so many ways. And
They're
this is a
little
good
demons.
example. I mean, yes, exactly. So but they do they do need help with grief for sure. The main thing actually that I think they need is to have a caregiver who's actually making their way through grief themselves, and then because if we're numb, as we were reminded of, or if we can't bear to think about it ourselves, or if it's taking up all the space in our mind, that isn't going to work for our kids, right? I mean, it's not going to. Then we would need to find someone else to help them, because we're not going to be able to do it. So in terms of what exactly to do, I think honoring the fact that children don't they can't, I don't know, to me, like they're very emotional, and then the next minute they're playing happily, and so that's one of the differences. And also they can't process too much at once. So those are things to maybe keep in mind. But Dr. Hankerson, you can take it from there.
Yeah, I would just to echo what Dr. Shear said, is that children do look it grief in children looks differently than in adults. And I think a classic example of that is with depression. When someone is depressed, we say one of the clear symptoms are feeling sad or down in the dumps, or not getting pleasure or enjoyment out of activities they may enjoy. But children who are depressed may be irritable, or may be angry, or may get into fights. And so I would imagine it's similar with grief, is that children, just thinking about my own two young children who are 4 and 2, um, at that age just don't have the mental capacity really to fully grasp a loss. And so they may act out behaviorally, they may become disorganized, they may cry, or there may be regressions for older kids. They may wet the bed, or they may behave as they were at an earlier age. And I think Dr. Shear's point about having an adult talk to them, be vulnerable about their own grieving process, and to help normalize that process is probably the most important thing that we can do for them.
All right. So find a great environment for adults to be able to talk to them, be honest, be open, model what it looks like, share their feelings, and be honest. Okay. Thank you. Um, what are the best ways that we can support loved ones, friends, even I dare say colleagues during these times? What can we do?
I'll go. I mean, I think that as at least in New York, as our COVID numbers are beginning to go down, and people are feeling more comfortable with being vaccinated, and or having had COVID themselves, trying to connect with people is a huge way of support. One of the damaging things that grief does is that it makes you feel isolated. It can make you feel isolated. And so connecting either through the phone or in person can be really, really important. Another thing I think is just to ask someone directly, how can I be most supportive to you, during these times? There's so much fear and anxiety. Just asking how they can be supportive is being helpful, and also just being available. A person who's going through a loss may not know how or what type of support they may need, but they may need you just to call and maybe cry with them, or just to talk to them late night as thoughts of their loved one come to their mind. So I think just being available and being willing to support in any way that is offered are the ways that we can support someone during these times.
I can't add very much to that at all, except to say that the one other piece of this is the way that you're available. I think it's so important, everything you said, Dr. Hankerson, and is to be able to spend the time. Sometimes it just being able to spend time with someone and really being there for them so that they do feel that connection, and not trying to make it better, actually, because there's a strong urge that we all have when we see someone, in pain, in emotional pain. We want to try to make it better. We want to try to say it's going to be okay. We want to try to say, oh, you shouldn't be blaming yourself. And okay, that's kind of okay, but a lot of times people just need us to hear them out. They just need to be able to verbalize. They need to feel heard, and feeling heard is huge in bereavement, just like it is, I guess, in life, right? But yeah, being there, that's it.
All right. So just want to acknowledge a comment from one of our guests, Asia McCoy. And she said, this is great information, and she wants to thank all of us for this platform tonight. So one question I want to kick over to Dr. Shear, that's specifically for you. In your work, you talk about derailers. And so I was wondering if you can share a little bit with our audience about what derailers are, and if you have any tips to address them.
Yeah, that's a great question, and thank you so much for it. So what we refer to as derailers, you can also think of as kind of another way to say that it is kind of defensive coping with the enormity of the pain and the stress that comes along naturally, again, with an important loss. And what it means, and so what these are some very natural kinds of responses, like the strong feeling of disbelief that almost everyone has right after someone dies. And so that's one thing that it usually kind of attenuates, but if it just stays and stays and stays, then it can derail that process of coming to terms with the loss or making peace with it in some way. And so can that sense of outrage, really, the protest that, no, this person shouldn't have died. It was wrong that they died. I don't understand why they died. There could have been so many ways that they didn't die. Keeping those kinds of thoughts, and actually it's, again, very natural to feel that way and to say those things to yourself in the beginning, but you kind of have to set them aside, along with the very natural, again, response of imagining alternative scenarios. Like, a lot of times, especially with, for example, a COVID loss, if only I hadn't gone, maybe I went someplace and got infected inadvertently, and then I brought that home, and then someone I love in my family died. I mean, why did I go? Why didn't I know? Why didn't I somehow protect my loved one? And that gets into the other realm of things that we were talking about earlier, all those different ways of self-blame and guilt. And then the anger that we can naturally feel, that can get in the way if it's too strong, because anger, it depends on what the anger is about and whether we can do something. We have to do something with anger and guilt in order to kind of put them aside, because they can really derail our ability to come to terms with the loss. And so can too much avoidance of things that activate our grief or trigger our grief. So those are some of the main ones. And also judging grief is another big one. If we try to figure out whether we should be grieving more or less, if we're not, grief is always what it's supposed to be. I mean, regardless of whether you call it prolonged grief or whatever, the problem in prolonged grief is not the grief. The problem is that we haven't been able yet to come to terms with the loss, to make some kind of peace with it, to accept its reality and restore our capacity to thrive.
Absolutely. Thank you all. So we are pretty much almost at time. And so I want to thank our audience members again for tuning in with us tonight. And I just want to turn it over to both of you to ask, is there anything that you would like to share with our audience members before we end our time together? So one last thing, anything that you'd like to share before we are done?
I mean, I'll just say that we have certainly been through unprecedented 2 years with the pandemic, with the increased awareness of structural racism in this country, and now with the groundswell of rates of depression and anxiety. If you are struggling with the loss of a loved one, if you after tonight feel like you may be struggling with prolonged grief, please tap into the Hope Center and some of the resources that we'll provide and give access to, so that you can, as Dr. Shear said, thrive and come to acceptance with the loss of your loved one.
Dr. Shear, from
Yeah.
you? I think we lost Dr. Shear's sound in that moment. Let's see if we can get back to you. Okay. I think we lost you there. We can still see you, but we can't hear you. But thank you again to our esteemed guests, Dr. Shear and Dr. Hankerson. Thank you to North Manhattan Alumni Chapter. Thank you, Rory, for joining us and giving us that welcoming message for tonight. If you are in need of additional services, please feel free to reach out to the Hope Center. We hope also, too, that you will reach out and find out additional information about programs and events that can support you in a variety of areas. At the beginning of our program tonight, we shared many announcements. And this information will also be up on Facebook at the conclusion of the program. We want to thank you again for joining us tonight. Say thank you, thank you, thank you. Please remember to take good care of yourself so that you can support those around you. And we want to support you in all the things that you need and all the ways that we can, and give you our best. So thank you again for joining us tonight. We will bid you a good evening.